All right, Alicia, all you. Go ahead.
Hi, everybody. I am Alicia Stillman, and I want to thank you very much for joining us today. I am the co-director of the American Society for Meningitis Prevention. Today, we are going to be talking about meningitis. Isn't new, but its impact on campus life is deeper than you think. And it's a really important topic. I will be co-presenting with my partner, Patty Wukovitz, who is the co-executive director, and one of our board members, Dr. Andrea Dooley. So we are going to be giving a lot of information and it's going to come at you really fast. And so any questions we are happy to answer at the end. Next slide. So I came into this world because this was my middle daughter, Emily Stillman. And in 2013, Emily was a college sophomore at a small liberal arts college in Michigan. She was completely healthy. She was up to date on all her vaccines. She was involved in campus activities and community activities. Her dream was to be on Saturday Night Live, and she wanted to be a stand-up comedian. My husband and I told her, you have to have a plan B, and so that was psychology, but maybe she would have made it. One night, Emily called me. She had a headache, simply a headache. I thought perhaps she was coming down with the flu. She thought maybe she was overtired because she had been up all night studying the night before for a couple large exams. We decided she'd take some ibuprofen and we would talk in the morning. That was the last time I ever talked to my daughter. She woke up a few hours later. She was living still in a suite type of a dorm environment. She said to her roommates, I think I need to go to the hospital. She walked into the hospital. She wasn't going prepared to die. She walked into the hospital with her backpack and a textbook and her iPad. She was going to get something for her headache so she could sleep better. She was not going to die. She didn't realize how serious it was. So they never called me. Emily was 19. I wasn't called until the next morning. Emily already at that point had slipped into a coma. She was being prepared for a craniotomy. They told me I should get to the hospital right away because the swelling was so severe in her brain. She had been admitted during the night with bacterial meningitis, and the swelling would be so severe that they wanted to lessen the degree of brain damage if she could survive. I was shocked. I just kept saying Emily has been vaccinated for bacterial meningitis. That's all I knew was that Emily's year was the year that they began to recommend the booster dose of the MenACWY vaccine. And we'll be explaining all the differences to you throughout this presentation. But I thought my daughter was protected. She wasn't. Within 30 hours, when I got to the hospital, from the time that she made that original call to me, they told me my daughter was brain dead. And I said, I'm going to figure this out. I'm going to figure out how this could have happened. And I said goodbye to my daughter on a really cold February morning with tubes coming out of every part of her body. I created the Emily Stillman Foundation in her memory to raise awareness for meningitis and to make sure that this doesn't happen in other families. We also do work because Emily became a hero with organ transplantation communities to recommend people to become and talk to their families about organ donation. Several years later, I partnered with Patty Wukovitz from the Kimberly Coffee Foundation, and she's going to tell you her story. But we were doing very similar work in each of our own parts of the country. And we created what was to become the American Society for Meningitis Prevention. And you'll learn about our work as we go and how we can help you. Patty?
Hi, everybody. Thank you, Alicia. I'm Patty Wukovitz. I am the co-executive director of the American Society for Meningitis Prevention, as well as executive director for the Kimberly Coffee Foundation. I'm a registered nurse. I live in New York, and my background has been in oncology and more recently in family medicine and a lot with immunizations. So this is my beautiful daughter, Kim, in front of you. She was my youngest child. She was perfectly healthy. Kim was a very funny kid. She loved to sing. She loved to dance. She performed. She was just an all-around great kid. Everyone loved her. She was just a very loving, kind, compassionate person. And at 17 years old, Kim knew that she wanted to be a pediatric nurse. So in June of 2012, Kim was in her last week of senior high school. The following week would be her prom. The day after that would be her graduation. And then 3 months to follow that, she would start her nursing education at a local um, nursing university on Long Island. She came home from school one afternoon and she texted me while I was at work and she said, Mommy, everything kind of hurts me. I have like body aches and I had a temperature. It was 101. I took some ibuprofen. I'm starting to feel better. And as soon as I got home, she was actually perfectly fine. She insisted that I call the pediatrician, and I did. And he said, these flu-like symptoms that you're describing could be just that, or if it gets worse, give us a call in the morning and bring her in. Throughout the whole night, up until the next morning, she was absolutely fine. I even slept in her bed with her that night, which was not something typical I would do, but I did. And when we woke up that next morning, things were really, really different. She said, Mommy, everything hurts me. Like from my eyelashes down to my toes, everything in between. Everything hurts so bad. She couldn't lift her head off the pillow. I mean, she couldn't move. And she said to me something that was so significant. She said, Mommy, I feel like my ankles are bleeding. So I looked at her ankles and she had tiny purple dots on her ankles, which is one of the hallmarks of meningococcal meningitis if it has infected your blood. Now, meningococcal meningitis was not on my radar. I just knew that she had something going on in her blood. Being a nurse, I knew this was serious. What was possibly going on here? Rushed her to the emergency room. And once we got there, they gave Kim they drew blood cultures, started IV antibiotics immediately, and pulled me aside and told me that they suspect Kimberly has bacterial meningitis. And I'll never forget the moment because I told that doctor, I said, she can't have bacterial meningitis. My daughter was vaccinated. Both of my kids are up to date on all their vaccines, including the meningitis vaccine. And in 2012, we had just one type of meningitis vaccine, which is the MenACWY vaccine, which protects against those four serogroups. And we'll get into that in a minute. So when I told the doctor it had to be something else, she said, well, there are five serogroups of bacterial meningitis. And we believe your daughter's results may come back that she has what's called meningitis B or serogroup B. Again, totally shocked. I couldn't wrap my head around this. How can my daughter be vaccinated, but you're still telling me she has meningitis? Made no sense to me. And things happened very, very quickly for Kim. She was put into the pediatric intensive care unit and she was in multi-organ failure. She was in septic shock and she actually went into cardiac arrest when they started her on dialysis because her kidneys weren't working about day two. They started her on dialysis. They were able to resuscitate her within a minute. and she was put on a ventilator at that point, and I never spoke with Kim again. We did have hope for her though. All the doctors, all the different teams of doctors were there, and we all had hope because had this significant brain activity. But at this time, because the bacteria had actually infected her blood, she was losing blood flow to her extremities. So her extremities started to turn black from lack of oxygenation. And they told me that if Kimberly survives this, she will likely be a quadruple amputee. So we were preparing ourselves for that, which is what we considered to be the worst case scenario at that time. And then 2 days later, it was also determined that Kim was also losing blood flow to her brain, and she was going to have brain herniation and ultimately would be brain dead. And then they took her for extra tests to show that, yes, in fact, she was brain dead. So we had to make the decision, and that was to remove Kim from life support. My whole family was with her. And we actually buried Kim in the prom dress that she had hanging on her closet door, which she was going to wear the following week. We buried her in this beautiful gold prom dress. And of course, it was heartbreaking, as you can imagine. And from there, I created the Kimberly Coffee Foundation because I just said, if I didn't know that there is another type of meningitis out there and I'm a nurse, how many other parents don't know this? I thought Kim was fully protected when she got vaccine, when she received the meningitis vaccine, but she wasn't fully protected. And at that time, I couldn't protect Kim. We didn't have a meningitis B vaccine. Alicia couldn't protect Emily. We didn't have a meningitis vaccine for Emily in 2013. So we had done all that we could. But fast forward into 2014 is when meningitis B vaccination became available in the United States. And that's when Alicia and I got together. And we both worked very hard to make sure that this doesn't happen to anybody else. So now I'll pass this over to Dr. Andrea Dooley.
Never gets easy to hear those stories after hearing them multiple times. It continues to be heartbreaking every time I hear that. So thank you both for sharing that. So I'm here as a board member. I got connected to this important conversation through an outbreak during my time at San Diego State. At the time, I was the Senior Associate Vice President for Student Affairs and responsible for student life, including residence halls, during my tenure there. And so, really, just such a powerful and meaningful part of my time as a student affairs professional was managing the outbreak at San Diego State. So, I have a few things as I think about my professional career and experiences, and one very noteworthy one that I'll never forget uh, was meeting a parent in the ICU. The daughter had just been dropped off for her start of her freshman year, and within a week was in the ICU with meningitis. I essentially, what this mom said to me was, I read everything the university gave us when I moved my daughter into the dorms. I thought I was doing everything right to protect her. When the doctor told me this could have been prevented with a vaccine, my heart sank. If I had known there was a vaccine for this, I would have made sure she got it. And at that time, we we had some conversations about vaccines for meningitis, but it wasn't as explicit. And she realized that it could have been prevented, and unfortunately, she didn't have the information. We didn't provide her with the information to support her in doing so. So during that time, we had that first case of meningitis, and it was confirmed with the County of Public Health in terms of her diagnosis. They reached out to us, after putting some pieces together with her diagnosis, working directly with the hospital and the physicians there. But what turned out happening is we had three cases of meningitis, which ends up being an outbreak. And so we spent the better part of a year and a half managing an active meningitis outbreak at San Diego State, which sadly was not uncommon. There were, I think, at least five other universities with active outbreaks around the country at the same time we were managing ours. So the student that I was just referring to, they arrived to school, moved into their residence hall. Classes started on August 27th, and it was Labor Day weekend, that she ended up in the hospital in the ICU. As I think often is the case, which showed up a little bit in the stories you just heard, was there was an initial misdiagnosis. So she realized she wasn't feeling well. She went to the hospital sent her home. She continued to not feel well. Her grandmother flew in to provide comfort and support and ultimately ended up in the ICU. And unfortunately, not understanding the symptoms and signs until it was too late. So in terms of our university expectation, obviously, first and foremost, there was the care and the concern for the students who are directly impacted, who are unwell, who are fighting for their lives. Fortunately, we didn't have any deaths as a result of our outbreak, but monitored and provided as much support as we could for the impacted students themselves. But we also, as a result of the public health emergency, we worked very closely with the County of San Diego Health and Human Services, specifically working very closely with the Director of Public Health for our county. And we got to work immediately, working with our Wellbeing Health Promotion team, our Student Health Services, working with different university officials and staff who were in our student affairs and residential life and housing areas. What we found out about the first case was that she had attended sorority recruitment. So she was in a variety of sorority houses, shaking hands, meeting with a number of girls through that process. She also had attended two fraternity parties. So there was a really wide range of potential spreading of meningitis through those experiences. And so what we did, based on the guidance that we received from the County of Public Health, was that we activated large vaccination clinics. So we started immediately providing post-exposure uh, medication. I'm not a nurse or tech um, trained in that way, but essentially what we did was working with the nurses from the County of Public Health is for anyone who was potentially exposed at sorority recruitment or at those fraternity parties, we asked them to come and get the medication in order to ensure that if they were potentially ill, that this would help to address that. We had long lines of students who are waiting for that vaccine or that prophylaxis. So we are very fortunate that our students showed up and they listened. They supported a lot of positive peer pressure with our students in order to get them there, in order to ensure that we could keep them as well and as safe as possible. Also got a lot of media attention through that experience. We also worked very diligently with our health and well-being teams, as well as our student affairs and residential and housing team members to look for signs and symptoms to be prepared if anybody came to them, and also to push that out so that students can evaluate that for themselves. And then we also, at that point, were not requiring the vaccine because it wasn't an outbreak at that time, but we encouraged people to get the vaccine. We started to lay the groundwork of helping students to know how to prevent and how to protect themselves. So ultimately, we did have an outbreak because of those three cases in 3.5 months. And in doing that, we continue to work with the County of San Diego Health and Human Services. They consulted with the CDC in order to get, that defined outbreak. And then we continue to maintain the education and outreach in order to really help to ensure that people are aware. And I think part of us identifying some of the cases as early as we did was because of that education outreach that we were doing. People were aware, people were looking out, they were mindful of their health and the symptoms that, were flu-like, but because of this that was going on, they were more aware. And we also let the medical providers in our region know so that they could be on the lookout for that as well. And I think that was really critical in helping us to learn about the additional cases, as well as protect those individuals. We did move into a place where we needed to vaccinate our population. It was something that was really critical. We were getting very defined expectations from the County of Public Health. They were very much, we met with them frequently, regularly. They were driving this because of the outbreak. And they were able to get vaccines from the state of California using some federal funds that are available for these kinds of things. We also ended up purchasing some additional vaccines ourselves, and I'll talk later about the actual cost of this outbreak to the university. And then we also stood up large vaccination sites where we brought students in large numbers and got them vaccinated, kind of like what, might happen in some of your locations for flu clinics that happen, seasonally. But this was very intentional to get people to get vaccinated for meningitis. We were doing the MenB vaccine, and I'll talk a little bit about that because this was specifically a MenB outbreak. But that was what we were making available at these vaccination clinics. And then we also worked very closely with our regional hospitals, pharmacies, doctor's office, really trying to make sure that they were stocked for the vaccine. What they found through this experience was that not all of the pharmacies or doctor's offices had the vaccine available. And so even if individuals were requesting it, it wasn't there. So that was really helpful that the county public health officer was able to tell them, hey, you need to get this vaccine and have it on hand for our students. So as part of our requirement with the County of Public Health to get students vaccinated, and it was very much a mandate from public health, and they were very much driving this work with us, taking away the things that we would have preferred to do at the start of a new school year. We were instead really focused on getting students vaccinated to keep them, healthy and safe. What we found, though, is that just having vaccines wasn't enough. Students weren't prioritizing that. Once we got through the immediate prophylaxis and they thought they were out of the woods, we realized we needed to have other incentives for students to come and get vaccinated. And so we had a really large target. I think we were looking at 90% of our population. We wanted to get vaccinated to really have that herd immunity set up. So we had food and other incentives, pizza parties. We had sororities or fraternities hosting vaccination clinics. We had athletes coming with their teams. We used student influencers to do videos to really lean into that positive peer pressure. We provided vaccination sites that were in our residence halls and some of those common spaces. We also found, because the MenB vaccine has 2 doses, that we had a pretty good rate on students getting their first dose, but getting them to come back for their second dose was a little bit harder. And so our rate for the second dose was lower. And so we spent a lot of time working to ensure they got that second dose. We continued to have really strong public health messaging around what the signs and the symptoms are. We thought about how we had videos trying to educate, inform, and encourage people to be aware of their risk, as well as to know what they could do to prevent and to protect themselves. One of the things that was confusing, and it was confusing for both our students as well as their parents, because we'd get a lot of parent calls in our student health services clinic, was that they would say, we already got vaccinated. And this goes a little bit to what was shared previously. And when they said we already got vaccinated, it was because they got the MenACWY vaccine oftentimes, but they didn't have that MenB. And they were missing the MenB, and that was the outbreak we had, and that was the defined risk for our community. And unfortunately, our immunization cards oftentimes just said meningitis. It didn't say which vaccine they got. And so it was very confusing. And we really spent a lot of time educating our community about their immunization cards. We put out socials on that, and really tried to do our part to help inform the community how best that they could stay protected, given what was going on, but also just in general. So in terms of our outbreak, um, our first student that got was in the ICU. They didn't continue their degree at San Diego State. I don't know if they went and pursued and completed a degree elsewhere, but it completely changed the trajectory of their lives. They moved into San Diego State full of promise. They were living in a residence hall. They went through sorority recruitment, and within weeks they were in the hospital, and within weeks they were back home. And that was not, what we want anyone's experience to be. So it really did impact them. We spent $175,000. That's direct money. That is actual cash spent to support this. Part of that was buying vaccines, and promotional materials and a variety of other things. So that's not a small amount of money. And that does not include money that the county spent with their direct costs, their staffing, and or, the federal funds that were used for some of the vaccines we received. Positive part about our outbreak is that we moved as one of few California campuses to requiring the vaccine. San Diego State moved to require MenB as well as ACWY for all incoming students. Unfortunately, this is inconsistent with the California Department of Public Health guidance, which makes it a, recommended vaccine. But for our community, given this experience, we decided to make it mandatory. Obviously, it creates some work in terms of compliance and managing that, but we thought it was worth it and it was an important thing to do. In terms of the values and the history and legacy, just, we really wanted to protect the health and well-being of our students. We wanted to mitigate the further risk, which is why we ended up making the vaccine required. Unfortunately, there was a death at San Diego State due to meningitis in 2014. There has been an ongoing relationship with that family, who have come out annually to support the training and outreach and information to student leaders, to help learn from the experience, the tragedy that happened. So that is something that we had a history of, and so that helped to inform our ability to require the vaccine. In the timing of the 2014, it was MenB, and the vaccine having not been available previous to that. And really what we want to do is to continue to maintain that thoughtfulness, that action, and to prevent the avoidable. We don't want any tragedies, the parent in the ICU saying, if this all could have been avoided. I don't want anyone to ever have to go through that experience ever again. So as we think about residential life professionals, one of the things I think about is that when parents and families and students are preparing to move into the residence halls, they read the deadlines. They look at when they have to pay their deposit. What do they have to pack? What do they do to prepare? So there's a captive audience. There's an opportunity to put materials, whether you can require the vaccine or you just have a statement about it, letting people know that the vaccines are out there, know the risks, know the opportunities. You have an audience and take advantage of it. There's a ton of materials. This organization does an amazing job making things available. Add that to what you provide to your families and your students. Oftentimes, RAs and housing staff are the first ones to be told when a student's not feeling well. And so the more that they know about meningitis and what the signs and symptoms are, that can make a huge difference. The sooner they get to the hospital, or if you learn a student had gone to the hospital and sat home, but they still don't feel well, think about how you can help, know the signs and symptoms to get them the care that they need. If from a vaccination standpoint, herd immunity allows for everyone to hopefully be protected, to the extent possible. It doesn't really work here. We need to have, students to be supported in their own way and, want to make sure that they all have those vaccines and wanting to make sure that it's normalized, that, if you can require the vaccine, require it, but that, you should be thinking about vaccines for your students, flu, whatever it might be, and that this becomes another one that our students are encouraged to get, both the MenB and the ACWI in terms of their role as they move into housing, being in those tight quarters. You don't want to leave anything up to chance. Oftentimes, if you engage your RAs, your peers, floor meetings, there's a lot of opportunities for engagement that allows for students to make those choices to get vaccinated and really thinking through how to make those positive. And one of the things that came through loud and clear when we had the outbreak is positive peer pressure goes a really long way. And so finding ways to make that possible in your environments. Also thinking about creativity. Have seen a lot with students who came to the university. They might have come from communities where they didn't get vaccinated, but now as an adult, making their own decisions in the university environment, they're choosing to get vaccinated for the first time for a variety of things. And so if you have themed bulletin boards that encourage the vaccine, they're going to see that, they're going to have that. And all students, will have a chance to see that, understanding the symptoms and the risk, playing some social media challenges, getting that information out there. Um, hopefully you never have an outbreak where you need to actually get people to vaccinate, holding rosters with your county to, to see who's been vaccinated, who's not. But really thinking about on the front end as a way of prevention, as you think about all the other wellness and student success initiatives, that this is one of them, and that you're thinking about that as you think about the creativity and what you inform your students about as you start a new school year.
Thank you, Andrea. Such great information. And also, keep in mind that the scenario that Andrea is referring to was specifically meningitis B. We know that many people are vaccinated with the MenACWI vaccine, but most are not vaccinated for meningitis B. So our work with the American Society for Meningitis Prevention was inspired by our daughters. You see Emily on the left and my daughter Kim on the right. Our key areas of focus are parent and patient education, healthcare provider education, policy advancement, vaccination equity, and advocacy training. We have a large network of advocates and we're always looking for more to participate. So if that's something that interests you, please reach out to us. So as mentioned earlier, it's important to know that there are 5 different serotypes or serogroups of meningococcal bacteria, and they are A, B, C, W, and Y. I know it's a bit of an alphabet soup, but it's important to know what those serogroups are because those are the 5 most common types that we see here in the United States and in adolescents and young adults. The 2 most common ways that this infection manifests can be one as sepsis or meningococcemia when the bacteria has actually infected the blood, which was in Kim's scenario, or symptoms of meningitis, which is a spinal cord or brain infection, which was Emily's scenario. And the symptoms are very serious and very severe of both. They come on very, very quickly, and they're all caused by the meningococcal bacteria. And when we talk about meningitis, just remember that this specifically is meningococcal and it's bacterial. We've all heard of viral meningitis, fungal meningitis. It's important to know that we're talking specifically about bacterial meningitis. It is a very, very easy disease to spread from person to person. It can attack without warning in a very healthy person. It can kill in a matter of hours, sometimes in as little as 24 hours. That is how fast and how devastating this disease is. And that's why it's so important that everyone understands the symptoms and how it's transmitted so that you can be on the lookout and get appropriate medical care very, very quickly. Unfortunately, 1 in 10 people who get this disease will die from it, whether irregardless if they got immediate medical care. 1 in 5 will face permanent complications like limb loss or brain damage. The symptoms can be any of these that you see here, or singularly, or a combination. So a high fever, a stiff neck, a headache, like the worst headache that they've ever had, extreme exhaustion, nausea and vomiting, or a purplish rash, which starts out as tiny little red spots. And then that rash will then blend into larger purple spots, and then it can cover the entire body very, very quickly. And the way that it's transmitted is because it's transmitted through the exchange of saliva. And we know that the age group of 16 to 23-year-olds, which is one of the high risks, we know that they exchange a lot of saliva. So whether it is sharing a drink, sharing, a bite of pizza, whatever it might be, they're sharing saliva. Being in close quarters with someone, and of course, obviously, we know in residential halls, being sneezed or coughed upon, kissing, again, the exchange of saliva, sharing anything that they're passing around, an e-cig or a vape, anything like that has the saliva. So that's important to understand that that's how that this is actually transmitted. So there are 3 types of meningococcal meningitis vaccines that are currently available in the US. We have the MenACWY vaccine, which protects against those 4 serogroups, A, C, W, and Y. It is routinely recommended, and many high schools and colleges require that MenACWY vaccine. Then we have the MenB vaccine, which protects against meningitis B or serogroup B. And that vaccine has what's called a shared clinical decision-making recommendation. And few colleges and universities actually require it, although many recommend it. But we do not have a large amount of universities that require it. And the newest tool in the toolbox is now there is a vaccine that protects against all 5 serogroups together. We haven't had this. This has been a very, very long time in the making, and it's a medical advancement. And we now have this vaccine that protects against all 5. And that can be used at the time when a patient is in to get their MenACWY vaccine and the MenB vaccine at the same visit. So this is a timeline that shows when vaccination should occur for meningitis. 11 to 12-year-olds will get the MenACWY vaccine. Then they come back at the 16-year-old visit, and they get the booster dose of the MenACWY vaccine. At the 16-year-old visit, that's when they're eligible to get the meningitis B or the MenB vaccine. So they can either get the MenACWY booster dose in one arm and the separate MenB vaccine in the other arm, or they can now have the MenABCWY vaccine at that one visit. And so, we want to, of course, eliminate a shot. Who doesn't want to get 1 shot versus 2? So that's the time when they would get the MenABCWY vaccine or the pentavalent because it protects against 5 serogroups. 6 months later, they do have to still go back and get the meningitis B vaccine. So again, the pentavalent vaccine comes into play at the age of 16, and that's when you can now get the meningitis 5-in-1 vaccine. The brand names are Penbria or Penmenvy, instead of getting those 2 separate shots. The second MenB dose still has to be just a MenB only vaccine. I know it's a bit confusing. And it's actually even confusing for the healthcare providers. So we do the best that we can to make sure that we give clear information on this in a confusing scenario. So there are critical issues affecting meningitis vaccination. The uptake of the MenB vaccine is much, much lower than that of the MenACWY vaccine. The recommendations for the pentavalent vaccine are difficult to implement in clinical practice. And one of the reasons is because then a provider has to stock yet another vaccine. Cases of meningococcal meningitis are rising with very new levels of unpredictability. Meningitis vaccination coverage rates vary by poverty status, race and ethnicity, and health insurance status. The ACIP, which is the American Advisory Committee of Immunization Practices, they make all of our recommendations for all vaccines for all of us in the US. They are expected to revisit the meningococcal meningitis vaccine recommendations in 2025. It's currently on hold right now, but we are hopeful that that will be revisited by the end of this year. So some doctors are not talking about meningitis B vaccination. And according to a study done in the Journal of Pediatrics, we know that 49% of pediatricians did not discuss the Men B vaccine during the routine visit when their 16 to 18-year-olds come in. We also know that 69% of family physicians didn't discuss the Men B vaccine during routine visits for their 16 to 18-year-olds at their visits. So it's so important that we all have the conversation. You know, we can normalize the conversation to talk about the different types of meningitis vaccines, not just the MenACWY vaccine. Another reason why we're not doing so well with meningitis B vaccination is because very few schools require the Men B vaccine. And a recent study found that a lack of requirement was the most frequent reason why healthcare providers didn't discuss it. So if their patient comes in at their 16, 17-year-old visit and the healthcare provider says, "Hi, you know, are you going to college?" And they say, "No, I'm not." The healthcare provider may not bring up that meningitis B vaccine, and they're doing a complete disservice, of course, as you can imagine. But it's so important that we understand that that's one of the reasons why meningitis B vaccination does not have great uptake. It's on the provider end as well. The other reason is parents decline the Men B vaccine because their child wasn't going to college. And we know that we have to protect kids whether or not they're going to college. They're all doing those same behaviors. They're all exchanging saliva. This is a map that we have on our website, and it shows that where college campus outbreaks have been in the past, as well as the colleges and universities that are actually requiring Men B vaccination. As you can see, there's about only 40 colleges that require Men B vaccination. And it's really important when you talk to your students because they'll tell you, "I've already received the meningitis vaccine." But you need to take it a step further and talk to them and say, "But there's also another vaccine, and it's specific for meningitis B, and it's likely that you have not received it. Let's check your records. Let's look at, we need you to follow up on this. Please don't let this just go to the wayside." It's so important, as you know, what can happen if you're not vaccinated for meningitis B. Another very important statistic is that since 2011, meningitis B has been responsible for 100% of the college outbreaks, all meningitis B. And again, because we are vaccinating more with the MenACWY vaccine. So all of these kids are going off to school, and parents don't know that their child might not be fully protected. They fulfill the requirement for their campus, for the college, but they might not be getting a meningitis B vaccine. The situation is better for the MenACWY vaccine, but again, it's still not great. You can see here the type of requirement here on the left in blue. This is the states that require a routine dose before the age of 16. And again, this is for the MenACWY vaccine. And then in the blue states, one dose is also required after age 16. In the states where you see highlighted in pink, one dose is routinely required before age 16 and then no additional requirement after age 16. And as you could see in the other states, absolutely no requirement to go into secondary school. Now, when we get to the college and university level, you can see also on the right-hand side that the color, the pinkish color, those states have a vaccine or a waiver requirement. So I can speak for New York State. There is a waiver requirement. The student and or parent is given information about the seriousness of meningococcal meningitis, about the vaccine that is available, and they have the option to waive it. Most of the time, that waiver is specifically for the MenACWY vaccine, and the MenB vaccine is never even brought up. And the other states have no requirement at all for college and university. So in the US, we are currently seeing an increase in meningococcal meningitis, which is mainly attributed to serogroup Y. And in 2024, we saw the highest number of cases since 2013. And now we're seeing cases disproportionately occurring in people that are aged 30 to 60. That's not typically the age that we see it. And we're also seeing an uptick in patients or people that have HIV. Additionally, we're also seeing a ciprofloxacin-resistant serogroup Y strains, so they are not responding to antibiotics. I'm going to turn it over to Alicia now.
So in the interest of time,
Yeah.
I am going to kind of rush through the rest of the slides so that there's more time for question and answers, because I think that we've thrown so much information. I just want you to be aware that additional factors are associated with the increased risk of serogroup B. First-year students are four times higher risk than non-first-year students. And again, be aware that even though we are addressing this with college, it's really everybody. Four-year college students are 5 times at a higher risk than non-undergraduates and Greek life students. And again, it all boils down to education and to the type of behavior that they're engaging with. Next slide. Meningitis vaccination is just not happening consistently in the United States, and Patty went into that. I'm not going to repeat it in the interest of time. Next slide. Our goal and what we're looking to educate you about is to bring everybody together, all the stakeholders, to deal with this issue. And we do believe that this is a major public health issue when we want to engage policymakers, parents, students, the broader community, providers, colleges and universities, and advocacy organizations such as ours. Next slide. And these are our different resources. This is what we can do to help you. We are willing to speak to any of your groups, any of your dorms. We provide resources. We can personally be available. We have posters, we have brochures, we have videos, we have magnets. We actually have a brand new video right now. Sydney, can you play the brand new video?
Think meningitis isn't a thing anymore? Let's talk. You're young, you're healthy, you also live in a dorm, share drinks, and go out. That's exactly how meningitis spreads. Did you get the meningitis vaccine as a kid? Good. But here's the thing. You need more than one vaccine to protect you from meningitis. MenACWY is usually given at 11 to 12 and again at 16. But there's another one, MenB, that you should have gotten between 16-18 and most students miss. You need both to be as protected as possible. Meningitis symptoms hit fast. Whether it's a headache, fever, stiff neck, or a purple-like rash on your body, it can get serious in just hours. Brain damage, amputation, even death. And the really scary thing, 100% of meningitis outbreaks on college campuses since 2011 have been meningitis B. The good news? You can protect yourself by making sure you get both the MenACWY and MenB vaccines. And there's a combined vaccine now too that makes it even easier. Most campus clinics offer them. It's fast, easy, and it saves lives. So remember, make sure you have received your MenACWY and MenB vaccines. Check your campus health center. Ask your doctor next time you go. Scan to learn more.
So attendees will receive this video to use on their campus at no cost after this presentation. And any of our resources are available at no cost, whatever we can do to help you to keep students safe. The key takeaway here is to help protect your students from meningococcal meningitis by making sure all adolescents and young adults are vaccinated against all 5 types of meningococcal bacteria most likely to cause meningococcal meningitis. A, B, C, W, and Y. We are here to help you, and it would be our pleasure. Next slide. Are there any, I know we are so late in our work, but anything we can do to help? Are there any questions? Does anyone want to put them into the chat or open it up? I do have the chat box open if anybody wants to put anything in there. Okay. Our email address is listed on there. We are available all the time. We have a team of dedicated people that work with us, and we are always available to help. Thank you for attending.